We are all humans. We have our differences, and that's what makes our lives interesting. For too often, persons with disability face barriers and stigma and don't receive the health services they need.
I think of what the world could be if we broke down these barriers. A world of respect and acceptance. It's our responsibility to ensure that our voices are being heard and that no one is left behind.
I close my eyes and I can see a world that's waiting up for me that I call my own. Through the dark, through the door, through where no one's been before, but it feels like home. They can say it all sounds crazy. They can say I've lost my mind. I don't care if they call me crazy. We can live in a world that we design. 'Cause every night I lie in bed, the brightest colors fill my head, the million dreams are keeping me awake. I think of what the world could be, a vision of the one I see, a million dreams, it's all it's gonna take. A million dreams for the world we're gonna make. However big, however small, let me be part of it all. Share your dreams with me. We may be right, we may be wrong, but I wanna bring you along to the world I see, to the world we close our eyes to see, we close our eyes to see. 'Cause every night I lie in bed, brightest color fill my head, a million dreams are keeping me awake. I think of what the world could be, the vision of the one I see, a million dreams is all it's gonna take. A million dreams for the world we're gonna make. For the world we're gonna make. A million dreams for the world we're gonna
Good morning, good afternoon. I think I can speak for us all here in the auditorium and probably everybody online in saying that was quite remarkable. Thank you, Shalva Band. You've certainly made us move around in our seats, and this has been an amazing opening to this session. So this is a band, the Shalva Band, comprised of 8 very talented musicians who are inspiring crowds around the world today, and I'm sure you'll all agree that they've certainly inspired us as we move forward with this side event. So welcome everybody again. Good morning, good afternoon. This is Side event on the highest attainable standard of health for persons with disabilities. A warm thank you to our co-hosts, the European Disability Forum, Germany, Israel, Norway, and the United Kingdom. And I thank you all very much again for joining us. My name is Rob Butler. I'm the Executive Director in the Regional Directors Division here at the WHO Regional Office for Europe. And I am very proud to be co-chairing this session today. We have a very busy agenda with many knowledgeable speakers. We will hear your views from across the WHO European region. I'm very grateful that we're all here together to aim for the highest attainable standard of health for persons with disabilities. The perspectives we will hear today will highlight the need of this resolution and what needs to be done to have an impact in the countries. And with that, I'm very happy indeed to introduce my co-moderator, Ms. Odelia Fitoussi, who is a member of the UN Committee on the Rights of Persons with Disabilities and professional manager of the NGO Joy for Kids. So, Odelia, I will hand the floor to you. A very good morning.
Very good morning. Thank you very much. Hello, everyone, and welcome. I know we have many guests here from all around the world watching the live stream of this event. We all have taken part in many virtual events, and some of them have been more inclusive than others. Organizers of this current event have dedicated more effort than for any other European regional committee toward the event being accessible. This event is an opportunity to learn and to do even better next time. So here is important particular information about our event today. For the benefit of persons with disabilities, persons with visual disabilities, we will ask our speakers to give a quick visual self-description when introducing themselves. For example, my name is Odelia and I'm a female, 44 years old, but I look much younger. Sitting on a black wheelchair, I have a lighter skin color and I'm wearing a white shirt with black striped blouses. Just 2-3 sentences describing some aspects of your visual appearance, as you please. For example, introducing your gender, age, decade, disability, race, ethnicity, skin color, hair, beard height, or clothing will be most useful. For people joining in virtual meeting directly, we have several options when it comes to language. We have spoken Russian as well as international sign language interpreters. Those who wish to access Russian translation can select the Russian channel by clicking on the globe icon at the bottom of the screen. Those who wish to access international sign language interpretation can pin the 2 interpreters' videos so that you can see them at all times while seeing the speakers as well. The sign language interpreters are identified as IS Interpreter 01 and IS Interpreter 02. To pin video, hover over the video of the participant you want to pin and click on 3 dots. A menu will appear and select pin. Closed captioning is also available. For the benefit of people watching the event on the WHO website, closed captioning and international sign language interpretation will be on at all times. I will ask all our speakers to speak in slow pace and as clearly as possible. I will also do my best to do the same. During the next 90 minutes, we encourage you to tweet about the event. The Twitter handle is number RC71CPH. We also warmly welcome questions and comments through the chat box, and on the Twitter, we will monitor those throughout the event. Now, at last, on to the program. In the last World Health Assembly, the WHO member states adopted a resolution on the highest attainable standard of health for persons with disabilities. I have been following the development of this resolution since it was only an initial idea, and I saw how it comes to life and a joint effort between countries, civil societies, and different experts and individuals. Now we must make sure that the essence of this resolution move into actions, and it starts with our mindsets. In personal view, today's meeting touches on the essence of human rights, the right to health and consequently to life itself. No life, no rights, no human. Moreover, even if a remedy is given to medicine, but it is done by disregard the will and the choice of the person himself, then it nullifies his existence. And if there is no he or she or them, so there is no me and us. Therefore, I really hope that the important and fascinating ideas and knowledge that we are going to hear today will motivate all those who waving with the human rights flags to act decisively in significant action in resources so we all benefit, all of us. Today, we will explore different elements from the resolution. We will try to point out to the direction of first steps we need to take together in the spirit of the resolution. It is my honor to introduce Israel's Minister of Health, Minister Nitzan Horowitz, to introduce the resolution. Minister Horowitz, the floor is yours.
Thank you, Odelia. Hello, everybody. And thank you for your amazing work so far. Honored Regional Director, Dr. Hans Kluge, distinguished colleagues. I'm really honored to be here today and to open this important side event on the highest attainable standard for health for persons with disabilities, following resolution WHA 748, which was adopted during the last World Health Assembly as a result of a joint effort by member states and the WHO Secretariat. I thank all of you, as Odelia said, for the time and the effort you have been dedicating to this significant issue. And I'm looking forward to what I hope will be a very meaningful event. Look, the core of the WHA resolution expands the concept of medical care for persons with disabilities from a narrow medical perspective, which sees disabilities as a medical issue, to a holistic social model that puts the person and their rights at the center, what we call in Hebrew, Ha'adam B'merkaz. This resolution urges member states, in collaboration with international organizations and other relevant stakeholders, to realize the highest attainable standard of health for persons with disabilities by ensuring access to effective health services as part of universal health coverage, that's very important, equal protection during health emergencies, and inclusive cross-sectorial public health interventions. This is the first resolution proposed on this topic after the adoption of the Convention on the Rights of People with Disabilities. And as such, it emphasizes the principle that persons with disabilities must sit at the decision makers table and be partners in shaping decisions concerning their lives. Nothing about us without us. That's what we say. Nothing about us without us. And this shall not remain a catchy slogan only, but meaningfully involving persons with disabilities in decision-making process in a precondition for ensuring disability inclusion in general and in health systems in particular. The resolution draws attention to a range of barriers, including physical barriers that prevent access from people with disabilities to health facilities, informational barriers that prevent access to health literacy, and attitudinal barriers which gives rise to discrimination severely affecting the rights of persons with disabilities. The COVID-19 pandemic, the corona, has demonstrated to us the challenges and obstacles faced by persons with disabilities around the globe. This is not just a European problem or an Israeli problem, this is an international problem. In some countries, essential health services that were already insufficient have become even harder for persons with disabilities to access due to COVID-19 restrictions or medical resources being allocated elsewhere. Without access to the care they need, persons with disabilities see their health status worsening, risking complications and additional permanent difficulties or reduced functional ability. Since the beginning of the pandemic, Israel has placed great emphasis on making health services accessible to persons with disabilities, both in terms of rapid and easy access to vaccines and COVID-19 testing, sometimes at home, to approving the use of transparent masks for persons with hearing impairments, transparent masks. The pandemic has made it clear that national and international health emergency plans must include persons with disabilities in every step of their preparation and implementation. On this special event, as part of the 71st session of the WHO Regional Committee for Europe, I would like to stress once again this important message. With an estimated 135 million persons living with some form of disability in the WHO European region, 135 million, Israel is convinced that the inclusion of persons with disabilities and addressing the barriers they face in accessing health services should be addressed under the WHO European Program of Work 2020-2025, which is called United Action for Better Health in Europe, and it must include persons with disabilities. We call all European countries to take an active action in order to achieve this goal. Let us work together, dear friends, to raise awareness of this important issue, identify regional opportunities to highlight its importance of advanced commitments to disability inclusion in the health sector, and define priorities and next steps for implementing the WHO Resolution 74/8 in the WHO European region. Aspiring to achieve the highest attainable standard of health for persons with disabilities requires a mindset change. It is an inclusive approach that will allow persons with disabilities to play more significant roles in their communities, in their workplace, and within their families. An individual who can enjoy a good standard of health is more able and confident to fully participate economically, culturally, and politically on an equal basis with others, thus contributing to the realization of several SDGs and the overreaching leave no one behind principle, leave no one behind. I'm full of hope that next year I will be able to see all of you outside of the virtual world, including you, Odelia, and the annual region meeting will be hosted in Israel. I thank you very much and wish you a very successful day of debates. Thank you.
Thank you, Minister Horowitz. And I can say that following your action in the last months, there is not just empty words. Thank you for putting this matter highly on the ministry's agenda. I am now proud to introduce our Minister of International Development, Minister Dag Inger Ullstein. The floor is yours.
Dear friends, for too long, much too long, persons with disabilities have faced barriers, stigmatization, and discrimination. The pandemic has made the situation even worse, causing disruptions in essential healthcare services, making the vulnerable even more vulnerable. Vulnerable communities, vulnerable persons in Europe and elsewhere, so we have work to do. The first ever Global Disability Summit in London in 2018 was a milestone, but must be converted into a stepping stone for further action. And that is what Norway aims to do when we are co-hosting and preparing the next summit in Oslo on the 16th and 17th February 2022. We will do it together with the International Disability Alliance and a co-host from the South, and with important input from all of you. The London Summit succeeded in placing the issue of rights-based, disability-inclusive development on the agenda. We wish to build on this progress, and we have high ambitions. At the Oslo Summit, we aim to fill the gaps. One such gap is the health gap, which was not on the agenda in London. Inclusive health will be addressed during the Oslo Summit. We will seek new commitments to accelerate inclusive development and to strengthen implementation of the Convention on the Rights of Persons with Disabilities. The summit will mobilize efforts that will support the principle of leaving no one behind and promote building back better and more inclusively in the post-pandemic recovery. To make this happen, we will seek close collaboration with states, multilateral organizations, and civil society organizations. We do not start from scratch on health and disabilities. We should all be proud of the landmark resolution on the highest attainable standard of health for persons with disabilities that we adopted at the World Health Assembly in May this year. It contains important provisions for member states on ensuring access to effective health services, including sexual and reproductive health services and access to health information, to protection during health emergencies and to public health interventions. These commitments are important in order to obtain equality for persons with disabilities and ensure their human rights in line with the Convention on the Rights of Persons with Disabilities. So we welcome and encourage new commitments, not least related to inclusive health. 1 in 5 people living in low and middle-income countries have a disability. The number is increasing due to factors like a rise in non-communicable diseases, or NCDs, and with populations aging. Non-communicable diseases may lead to disabilities, and disabilities may lead to non-communicable diseases, not least because of vulnerability to poverty and exclusion from healthcare services. Disability and poverty reinforce and perpetuate one another. We are currently developing a strategy here in Norway on disability inclusion in the context of Norwegian development policy. Leaving no one behind is not only our approach to working with persons with disabilities, it is the underlying principle of all our work with development and fighting poverty. But it's not about special rights. It's about making sure that people who have the same needs as everybody else also enjoy the same rights as everybody else. It is about making sure that those who need education, jobs, and basic services as much as everybody else also have the same access to education, jobs, and basic services as everybody else. It is about making sure that we do not see only the obligations, but also the enormous opportunities in this. So, thank you.
Thank you very much for these words, Minister Ulstein. I was very glad to hear in your speech that you identified inclusive health as opportunity and not as a burden. I am pleased to introduce the WHO Regional Director of Europe, Mr. Hans Klug, for opening today's event.
Thank you so much, Odelia. And you asked us to say something about ourselves. So I'm 52 years, but unlike you, I'm probably looking much older because this is the last day of the region committee. And in the morning we had a little bit down energy, but after this fantastic introduction, I must say I feel very, very energized. And thank you so much, Odelia. Thank you to Mr. Minister of Israel, and reminding that psychologically we're already on the way to the region committee to Israel next year, and to the Minister of Norway and all colleagues. So about disability, you asked, my disability probably is my vision, because without glasses, I don't see anything. And I'm always reminded in the morning, if I don't find my glasses, right, how fortunate that we are, that there are new technologies, really, and that we need these new technologies to help all of us. Because as the minister, Nitzan Horowitz, was reminding, in our region, 135 million people have some sort of disability. I mean, that's really a lot of people. And most people we know will experience difficulties in functioning at some point in their lives, particularly when growing older. How much disability a person experiences in daily life changes and depends on how their impairment or health condition interacts with what we call the barriers in society. So, how do we now turn vision into action? First, our health systems must integrate the needs and requirements of persons with disabilities. So we have to be open-minded for it. We have to realize day by day, not just at an event. So we need to be inclusive. Barriers, we know, are of different types. There are physical barriers that prevent access to health facilities, to specific interventions, but also in public, right? I think we all know examples. There are informational barriers that prevent access to health literacy and information. And there are very important attitudinal barriers in our attitude, which perpetuate stigma and exclusion. Both Minister Horowitz and Minister Ulstein were telling, leaving no one behind. Leaving no one behind is the core of our vision, the European Programme of Work, United Action for Better Health. So the first is to integrate the needs of the people with disabilities. Second, we need to work across sectors to design public health interventions that address what we call the social, economic, and environmental determinants of health. To design the intervention in a way that all persons with disabilities feel included. Because we speak about health, but remember the definition of health is not just the absence of disease. It is psychologically, social. Can the person with disabilities, even feeling maybe physically not so well, feel well in social interactions, to be able to socially interact, particularly in this COVID-19 times, where physical and social restrictions really were hampered. And finally, while these efforts will support the development of inclusive national and international health emergency preparedness and response plans, we must also ensure that persons with disabilities are consulted and engaged in all phases of emergency programming. Minister Horowitz mentioned the World Health Assembly resolution, and we also discussed with Ambassador Meiraf Shahar in Geneva, I think 2 or 3 weeks ago, together with Dr. Dorit Nitzan, how important it is that our region now plays a pioneering role. I would like our region to be the frontrunner to implement and realize the World Health Assembly resolution. And to this end, in line with the principles of the European Programme of Work, we will continue to work in partnership with non-governmental organizations, civil society. I strongly believe in civil society, such as the European Disability Forum, because the needs of the people with disabilities in our region needs to be heard. An inclusive and accessible health sector remains the key to better health and achieving a equitable society in the European region. Thank you so much, Odelia. Thank you so much, everyone, for giving me this fantastic opportunity. Thank you.
Thank you very much, Dr. Klug, for recognizing the importance of the resolution. Health system must indeed recognize and address the need and requirement of persons with disabilities so that nobody experiences exclusion from health services. It is now my honor to welcome the Israeli Member of Parliament, Ms. Shiri Pinto. Member of the Knesset Pinto is the first Israeli Member of Parliament that uses sign language. Member of Knesset Pinto is a political leader that promotes the rights of persons with disabilities in Israel. The floor is yours.
Okay, dear guests, I'm thrilled to speak on this platform today as part of the 71st session of the WHO Regional Committee of Europe. I'd like to thank the WHO Regional Director for Europe, Dr. Hans Kluge, and the colleagues from all member states. In the past year, Israel has led, for the first time, in collaboration with other countries, civil society organizations, and WHO Secretariat, a decision on health for persons who live with disabilities, a significant political step for Israel. I'm happy that we gathered here to discuss this important matter. Israel was part of forming the UN Convention on Rights of Persons with Disabilities, which Israel ratified in 2012. Accepting the convention, making countries sign it, and the process of ratifying it was the peak of the activity for international acknowledgement of human rights of persons with disabilities. Unfortunately, I regret that despite Israel's declarative engagement in signing the convention, it is only partially implemented. I'd like to emphasize the necessity of fully implementing the convention. There is no disagreement that it is appropriate and profound perceptual framework to promote the status, welfare, and well-being of persons with disabilities in Israel and around the world. If I may say a few words about myself, I'm a member of the Israeli parliament, the Knesset, the first deaf member of the Knesset in the history of Israeli politics. Since I was young, I was socially active in promoting rights of persons with disabilities, in particular deaf and hard of hearing. I represent a public of 2 million men and women with different disabilities, physically, mentally, sensory, and cognitive, and other invisible diseases such as Tourette syndrome, endometriosis, and more. Statistically, we're talking about 1 out of 5 persons who live with disability in Israel, a public that for years has been socially marginalized to what I call the human periphery. My main mission, as I see it, is to give voice and fulfill their demand to be an integral part of society, who shapes its agenda in the crossroads of public decisions making, a part of the life structure in Israel. Providing and receiving health services for persons with disabilities is one of the main and acute subjects needed to be addressed. In regards to improving the well-being and in the implications of raising awareness to accessibility in the general society, my conclusion is definitely rises from the personal experience as well as from the constant discussion on this subject in the public. The COVID-19 pandemic that burst into our existence in the past year and a half has influenced every aspect of our lives. One of the consequences of wearing a mask as a preventive measure of spreading the disease is hiding half of the face, especially the mouth area, a matter which makes it very difficult for deaf and hard of hearing persons to understand what's being said to them, because they rely on lip reading and facial expressions to understand nonverbal messages. In the spirit of this blessed and important decision that we mark today, one of the first actions I took as a parliament member in collaboration with the Minister of Health was formalizing a ministerial directive to use, provide, and maintain a stock of see-through masks according to the demand of hospitals in Israel. Thus, in a small but significant step, the system learns to adjust itself to an accessible, meaningful medical service. Research and surveys has proven that persons with disabilities experience the health system and medical care more suspiciously, with lack of trust and openness when interacting with the medical staff. Moreover, the coronavirus brought a number of challenges that persons with disabilities have to deal with, such as lack of accessibility to technology, lack of diverse accessibility of accessible informational materials, and dependency on other people for care. While hospitals seek to give equitable medical response, medicine is moving toward personalized medical treatment. Furthermore, this issue of independency and codependency, which is relevant to every person hospitalized, increase a level when there is no specific reference to functioning. The time has come to change the perception of medical care for persons with disabilities from a narrow medical perspective that views disability as a medical impairment to a holistic perception. For example, making sure that all medical facilities, hospitals, and communities' medical clinics are physically accessible, writing and implanting suitable regulations and service perceptions that includes changing the treatment of persons with disabilities as customers. In terms of medical treatment, creating knowledge that interfaces between doctors who are disability experts and hospitalization doctors so that they will understand the medical case in relation to the disability and its consequences. The key to changing the society and institutional paradigm of focusing on the physical impairment as a primary feature that defines the person with disability and his whole identity starts with awareness. The different appearance or behavior with persons with disabilities sometimes create unjustified fear and reluctance in the general society. The inability of the society to include persons with disability prevents direct contact between the two populations and distances the opportunity to break prejudices that are deepening in the meantime. We must use various tools to remove alienation and bring persons with and without disabilities closer, based on promoting inclusive, accessible, approachable culture of awareness. We will do it according to the principle, nothing about us without us, that expresses the right and clear demand of persons with disabilities to be present and leaders in every conversation, let alone in policy decisions about integrating them in the general society. The echoing message is disability isn't disabling. It is the society that disables. I would like to thank the Israeli delegation to the UN and the World Health Organization for inviting me to be a part of this important discussion. I'm full of hope that marking this step will be meaningful in emphasizing the idea and reality in which human dignity is the main value, that through it is possible to think of disability as a human and social phenomenon that promotes interactions and reciprocity. Thank you.
Thank you, Member of Knesset Pinto. You are the third person that speak about how persons with disability need to be around the table when we're making decisions. And I really would like to ask you A question: what do you see as a first step that political leaders should take to further the field of disability and health?
Thank you, Adelia. Thank you. I think that the most important step will be establishing a professional team with hospital and clinic seniors, academics, and head of civil society organization concerning people with disability, where also people with disabilities themselves to start a process of writing a systematic protocol for providing treatment and medical services tailored to persons with various disabilities, like physically, sensory, and cognitive. That's the primary crucial step to build a tailored, personalized, and accessible health system.
Thank you very much again. You know, probably you surely know
Thank you.
that next week it is International Sign Language Day. So could you teach us a few signs that all of us should know?
Happily. So now we just started the new year, new Hebrew year, and we're celebrating a Rosh Hashanah holiday. So I will teach you a sentence in sign language. This is year, and good year. And this is sweet, and accessible, and healthy.
Thank you. Thank you again, member.
Thank you, all of you.
Thank you again, member of Knesset Pinto. I'm now glad to introduce the president of the European Disability Forum, Mr. Yanis Vadakastinst. Thank you. Sorry if I didn't pronounce the name good, but it's with all my heart. Thank you very much.
Thank you, Delia, for presenting me. My name is Yanis Vardakastanis. I come from Greece. I'm 64 years old. I'm the president of the European Disability Forum, as you said, and the president of the Greek Confederation of Organizations of Persons with Disabilities, treasurer of the International Disability Alliance, working closely with WHO, and a member of the European Economic and Social Committee. It's a great honor for the European Disability Forum to co-host this very important side event. Let me begin by saying a few words about EDF. The European Disability Forum is a representative organization of persons with disabilities, what we call a DPO, Disabled People's Organization. It means we are run by persons with disabilities and our families. And we advocate for the rights of over 100 million persons with disabilities in Europe, but also we advocate for the European Union to be more inclusive in international cooperation, external action, and humanitarian action. We are very committed to collaborating very closely with the World Health Organization Office for Europe, and we have appreciated the cooperation we have had so far during the COVID-19 health crisis. It has marked the beginning of a long-term cooperation with WHO in our region, in which we aim to work together to improve access to health for persons with disabilities. COVID-19 was a wake-up call for the disability community. At the beginning of the pandemic, we needed to very urgently react to a health crisis which disproportionately affected us, and public health measures in many instances excluded and discriminated us. Even before COVID-19, more generally speaking about health, persons with disabilities tend to receive health care of lower quality that is not adapted to their needs. The inaccessibility of healthcare services, the lack of accessible information about healthcare services and entitlements, the lack of adequate training and flexibility for healthcare professionals, misconceptions about the healthcare needs of persons with disabilities, and discriminatory treatment against persons with disabilities in health insurance have been identified by us as major barriers in accessing healthcare. Free and informed consent very often is denied to persons with psychosocial disabilities, intellectual disabilities, or persons under guardianship in their access to mental health services in the European Union. We all have the right to free and informed consent to health care. In addition, insufficient attention has been given to people facing a greater risk of exclusion as a result of the intersection between gender, sexual orientation, age, racial and ethnic background, and other grounds of discrimination such as disability. In particular, access to sexual and reproductive rights is largely impossible for many women and girls with disabilities. In recent years, EDF has contributed to the development of disability inclusive health policies at the European level. We have, for example, advocated for the EU, including its agencies working on the health, like the ECDC, to be more inclusive in their policies and practices. In our 2021 Human Rights Report, we looked at the impact that COVID-19 has had on persons with disability. In a separate policy paper, we focused on EU global role in COVID-19 response and on actions that the European Union has taken in other regions of the world. Our call request regarding the implementation of the WHO resolution in the European region. European leaders should very politically be committed to the CRPD and the rights of persons with disabilities in all implementation processes of the WHO resolution and all who work on health in general. Equality and non-discrimination of persons with disabilities should be guaranteed in legislation and practice. Persons with disabilities, in particular women and children, should be more protected against violence, abuse, exclusion, coercion, and neglect. Measures should be adopted to ensure the structural and systematic involvement of all persons with disabilities through their representative organizations in implementing the resolution and all related processes, policies, funding, including the most disadvantaged groups, including persons with psychosocial disabilities and intellectual disabilities, who are very often denied their legal capacity and their access to decision-making powers. Of course, we welcome the reference made to data in the resolution. We also call for guaranteeing that all persons with disabilities can exercise their legal capacity in health care, in related other health issues. Their free and informed consent should be also guaranteed prior to any health-related decision, including vaccination. We call for the development of guidelines of free and informed consent and training of healthcare professionals on disability awareness and provision of reasonable accommodation. We have worked, as I said, very closely with WHO Europe to make key public health messages more accessible to persons with disabilities. Two guidance notes were prepared for DPOs as well as member states on disability inclusive information. Two videos were also prepared as well on this topic. All documents are and videos are in English and in Russian available. I would like to leave you thanking you for your attention and to see now the video on disability inclusive health information. Thank you.
Whether people have a disability or not, digital mediums might not be accessible for all. Inclusivity for everyone means that information must also be made available via posters, print, radio, and SMS messages. There can be many reasons for this. Persons with disabilities may be at an increased risk of contracting and experiencing complications from COVID-19 because of the underlying health conditions and stigma within the society. Information is often not accessible, and too often people with disabilities are out of the public eye, especially when they are in residential healthcare settings and care homes. The close interactions with support staff that some persons with disabilities require often increases their exposure to COVID-19. Too often, discriminatory attitudes towards disability continue to be prevalent. As we continue to navigate this global pandemic, what can we do to ensure that persons with disabilities have equal access to healthcare systems and make sure that all critical information is fully accessible? No matter how complex the wider societies they live in, whether it's in towns or cities, it's vital that persons with disabilities are quickly identified and located. Many European countries are already undergoing reforms to close down institutions for persons with disabilities in the near future. Persons with disabilities should be living independently at home in inclusive communities. Speeding up this process in times of the pandemic will help protect persons with disabilities against their higher risk of contracting the virus. Such institutions must be especially vigilant in adhering to measures that contain the virus. Women with disabilities are among those facing multiple discrimination and are therefore at even greater risk. Disabled persons' organizations are often the best point of call when it comes to helping identify those most marginalized. Those organizations do an important job and must be supported. And there are other inclusive solutions that need to be implemented immediately. Where possible, locate persons with disabilities by ensuring tracing apps and mainstream databases for emergency support are inclusive and accessible. Tracing apps should be accessible for all, including persons with visual impairments. To make critical information accessible to everyone, messages must be produced in multiple formats and all local languages. Emergency hotlines must function equally well for everyone, for example, persons who are deaf or have a hearing impairment. Ensure that essential items can be delivered to those who need them, both in towns and in cities, and also to those in remote areas. The COVID-19 pandemic remains a challenge and persons with disabilities are amongst those at greater risk. This will remain so until all emergency health services are fully accessible and disabled persons' organizations are involved in the planning and preparedness measures. A disability inclusive response is always more effective and efficient for everyone.
Thank you, Mr. Vadakastanis. You see, I improved. And one sentence that I'm taking for what you are saying, that we need to be aware for double exclusion of person with disability, with a different culture, different gender. The resolution was a joint effort of many member states who shared best practices and perspective. I would like now to invite two speakers to do just that. First, I would like to invite from Germany, Mr. Jürgen Dussel from the federal government Commissar for matters relating to persons with disability. Thank you.
Yeah, thank you very much, Odelia. And as you told me to describe myself, I try my very best. First of all, I'm 56 years old. Maybe I'm looking a little bit relaxed right now because I'm coming back from vacation, from holiday from Italy. And I hope this will continue because now we have in 10 days the German election. So we see what's going on. I'm male. I have brown hair. I have green eyes, and I'm wearing I think gray suit and a white shirt without a tie. This is very important for me. Without a tie, and yeah, thank you very much for the invitation, dear ministers, dear Ms. Pinto, dear Dr. Kluge, dear Yanis Kalimera to Greece. Dear ladies and gentlemen, first of all, let me say thank you very much for the invitation to this conference, because this is for me a big honor and a privilege to talk to you. And because the equal access to a quality health system is one of my major subjects which I'm committed. Ladies and gentlemen, I think after the ratification of the UN CRPD, the contracting states, the contracting countries have committed to provide fully access to a health service, to a health system in the same range, in the same quality, and at the same standards as they provided it for persons without disability. And we all know that the idea of Article 25 of the CRPD is the reason why we are working on this. And this, I think, is still a work in progress. The obligation of the UNCRPD, especially in this case from Article 25 of the UNCRPD, the obligation includes both inpatient and outpatient health services. And when I'm talking about that, I'm absolutely convinced that we have really have to work on it, because until not every doctors or therapists practice is really 100% accessible, we haven't reached that goal. Ladies and gentlemen, everybody said it, but I will continue, I will remember, and I will just say it again because it's so important for persons with disability. The COVID-19 pandemic is the really latest example for the urgent need of a comprehensive accessibility policy. And let me add, it's also, for me, the latest example for the urgent need of a worldwide inclusive policy. Because what we learned during the pandemic and in the pandemic is that we only have the chance to overcome the pandemic and this global crisis if really everybody has free access to a free or affordable healthcare or health service, for example, for vaccination. This is very important for our whole society globally, and that makes clear that, yeah, Article 25 is so important really for us. And when I'm just talking about accessibility, I mean really the whole range of accessibility. I mean accessibility and the free access to the health services for people with visual disabilities, for persons who need sign language, for people and persons with cognitive disabilities who need easy languages. And I think it's very important to say also, of course, for persons with psychological disabilities and, of course, physical disabilities. And for that, ladies and gentlemen, to face this challenge and just to manage this challenge, we need a lot of expertise. And when I'm talking about expertise, I'm talking about, of course, expertise for the professionals. But one point is very important for me. I think we need more expertise in the education, especially in universities or in schools. We need more expertise in the educations of the professionals of tomorrow. And I think there is really a lack there in, for example, the university education. I myself, by the way, I studied law. I know a lot of persons or people who just studied medicine, and they had nothing in university education about, for example, accessibility or persons with disability. So this is very important. And the Minister of Norway, I think also everybody said it, nothing about us without us. And that means that we need the expertise of the persons with disabilities who are experts in their own case, and they can very easily explain how we can support them and how and what they need just to make sure that they have access to this human right of Article 25. Let me point out one thing which is very important for me, Odelia, and it was really important the whole term of my stay in office right now. I want to talk about the situation of persons with disability in hospitals. Having to go to a hospital is for everybody a challenge. But for persons with disability, it can be traumatization. It can be really a big problem, even for them, and even also for the relatives. I'm talking, for example, of persons with cognitive disabilities or persons who need very much assistance. And so, yeah, we just achieved in Germany a breakthrough in this point, a breakthrough to which I just personally campaigned a lot together with a lot of NGOs. We just achieved a legal regulation which is already now in the legislation, and I'm just waiting until it's passing through the Bundesrat today. And this legal regulation gives people with disabilities who needs assistance in hospital the right, really the right, to be campaigned and bring someone with them into the hospital, either a professional assistance service or the familiar person or someone from the social circle. And the most important thing is that this service will be financed, it will be paid. And we are looking very forward today that this regulation will pass through the Bundestag. Ladies and gentlemen, accessibility, in my opinion, is really a cornerstone of a good health service. And it's not only a thing which is nice to have. For me, it's very important that, of course, accessibility has a very deep social impact. But it's also a sign of quality for a modern country. For me, accessibility is really the sign of a modern and an innovative country. And I think this is really to point out. And for that, ladies and gentlemen, the international exchange is so important. And that's why I do appreciate so much to be with you, because we can learn so much from each other and we should learn from each other. So at the end, let's say thank you again. It was a pleasure to be with you. Thank you very much for your attention. And I'm looking very forward now for the conference and of course for the next speakers. Thank you very much and all the best from me from Berlin.
Thank you very much, Mr. Duzel. When you spoke about the person that needs assistance in the hospital, so I probably thought about myself, but also me as a person that accompanying another person to the hospital and how much is not accessible. So it's very important to have it. From the United Kingdom, I would like to introduce Mr. David Nutter, Deputy Director for Neurodisability and Neurodiversity, Disability and Learning Disability. Thank you.
Great. Good morning, and can I say a thank you to you, Adelia, to the organisers, and to all the other excellent speakers for bringing this event together today. I think it's striking to me just how much common ground there is, and how much of what's been said and shared resonates for the UK. My name's David Nuttall. I'm the Deputy Director for Neurodiversity, Disability and Learning Disability at the Department of Health and Social Care in England. And by way of description, I'm male, I'm in my early 40s, I'm white with dark hair, and this morning I'm wearing a blue shirt and a black tie, and I'm also wearing a headset microphone to join in this call. So I have a short presentation to give this morning. So if I could just go to the next slide. Just to say a little bit about the context of disability in the United Kingdom. You're considered to be disabled under our Equality Act legislation if you have a physical or mental impairment that has a substantial and long-term negative effect on your ability to do normal daily activities. So that's how we define disability in legislation. And under that definition, more than 1 in 5 people in the UK are considered to be disabled, which is over 14 million in the population. And I think although much progress has been made in improving outcomes and experiences for disabled people, we know that there remain significant obstacles and there is much more work to do. And we can support that with evidence. So, for example, disabled people report on average well-being ratings which are poorer than those for non-disabled people, for happiness, for feeling worthwhile, and for life satisfaction measures, as reported in 2020. And we know also that average anxiety levels were higher for disabled people, with a score of 4.5 out of 10 compared with 2.9 out of 10 for non-disabled people. And similarly, disabled people in the UK reported feeling lonely almost 4 times as much as non-disabled people in 2020. So there remains much work to do. If I could go to the next slide. So for this presentation, I want to talk about 3 areas which I think are critical ways in which we can achieve the highest attainable standards of health for disabled people. Firstly, removing barriers that prevent access to quality health and care services. Secondly, the need and importance of cross-sectoral interventions to address wider health inequalities. And thirdly, supporting and protecting disabled people through health emergencies. And I want to share some learning and provide just a few short examples which I think align with the elements that Dr. Hans Kluge set out earlier. So if I could go to the next slide, please. I want to talk here about how we are removing barriers and integrating to meet the needs of disabled people in health and care systems. And I think in this theme, our key learning has been that health inequalities can be addressed by reducing barriers, including physical barriers, and that we can do this by using data and evidence to inform how we provide services, by training staff to understand disability and the needs of disabled people, and to personalize care. To give a couple of examples here, one of the things that we are doing currently is developing and trialing training on autism and learning disability, which when that pilot is complete, we intend to introduce as being required for all 2.7 million health and social care staff in England supporting people with a learning disability or autistic people. And the intention here is to give staff the right skills, competency, capability to ensure everyone with a learning disability and all autistic people have a positive health and social care outcomes. And we can do that through, for example, improving the way that we communicate with people and improving access to services. My second example here is about facilitating adapted living to help people stay independent and healthy for longer. And we are providing capital funding through grants, firstly to support older and disabled people to be able to adapt their homes, to stay in them, for them to remain safe and suitable for their needs for longer. And secondly, to invest in building new specialized housing for older peoples and adults with learning and physical disabilities or mental ill health, enabling them to live independently for longer. We have legislation which has been introduced, which requires all public providers of health or social care to follow or to make information accessible, so that people with who are disabled, who have a sensory impairment, can get information in a format and a way that they can understand. And finally, we are in the process of reforming our adult social care to better meet people's needs, improve the quality of care, and reduce preventable admissions into hospitals. And we recognise very much that each individual's need can be very different, and that we need care to be personalised. And that is a theme which runs through all of our reforms. If I can move on to the next slide, please. I think we all recognise that the importance of cross-sectoral interventions in order to design interventions that will address all the different determinants of health. And I think what we have learned from our experience in the UK is that in order to improve disabled people's lives, government must work with and across wider society, including the private sector, the voluntary and charitable sectors, and a whole range of organisations working with disabled people to address the range of factors that disabled people say impact them the most. And just to give two very quick examples of things that we have been doing recently, we have published in July 2 national strategies. One, a national disability strategy, which is a truly cross-government effort to transform disabled people's everyday lives, informed by a quite substantial exercise to gather information from disabled people directly. And this is supported by the introduction of champions in each government department who will take responsibility and have given personal commitment to driving progress in those areas that they are responsible for. And the second example is the introduction of a strategy specifically to support autistic children, young people and adults, which we also published in July, which sets out our vision to make life fundamentally better for autistic people, their families and carers over the next 5 years. And it intends to do this by enabling better access to care, to education and employment opportunities, and by really focusing in on reasonable adjustments so that autistic people can experience equitable access to public services. And both strategies are backed by investment to support implementation. If I can move to the next slide, please. The third theme, which I wanted to just talk about here, and other speakers have talked about considerably as well, is the need to support and protect disabled people through health emergencies. And I think the key message or learning that we have taken from the experience over the last 18 months to 2 years is the real importance of considering the individual needs of those who are most at risk, and to be able to learn quickly from emerging data when we're responding to health crises. And by that I mean new information, new evidence and data as it emerges, for example, on the impacts on particular groups of people or particular disabled people, that we need to be able to adjust our response quickly in response to that. I won't go through all of the list which I'm showing in detail. In common with what has been described by other people, the really central elements of our response to the COVID-19 pandemic in terms of protecting disabled people has been to prioritize vaccinations for those who've been identified through the evidence as being most at risk of the severest outcomes from COVID-19. Providing guidance and advice for those who we have identified and considered to be clinically extremely vulnerable to poor outcomes from COVID-19, again informed by and shaped by available data. Another elements which will be common to the response in other countries include increasing access to testing for those who are most at risk, helping support those who are self-isolating, and we have a volunteering scheme that would enable those that are self-isolating who need support to have access to medicines, food, other deliveries, and so on. Support for the voluntary sector has been a really important element of this, particularly as some of the voluntary sector will have greater reach to some disabled people in a way that government may not, and increasing the use of technology to provide people with more convenient options to access the care they need. So if I could just go to the final slide, as I'm conscious of time, I think just to kind of conclude the message and learning from the United Kingdom's experience, we think there have been many positive changes for disabled people made in recent years, but we understand there is much more to do. Health and care systems must incorporate the needs of disabled people and provide personalised care, and they must do this by collecting data and using it to help target, support, and identify where the gaps exist. Disability is everyone's business. To properly address the issues that impact disabled people most, government must work across wider society to drive change. And disabled people may be disproportionately affected by health emergencies. Governments can and must take steps to minimise the impacts, including by responding quickly to lessons learnt from emerging data and evidence. Thank you very much for listening.
Thank you very much, Mr. David Nuttall. We're back in the auditorium with me, Rob Butler. I am a 49-year-old male Englishman. I'm sat here in a dark blue suit, a very boring pale blue shirt and red tie. I'm 49 years old. My daughters tell me I look that age, but they tell me also that I behave a lot younger, which I always take as a compliment. So we're back in the auditorium here in Copenhagen. I'd like to thank David and Jürgen for those points that they've made. David, I really picked up your points on shining a light on the value of data, service accessibility, the importance of social and healthcare staff skills, and also from Jürgen, really appreciated that point about the invisible disabilities. And I think if we had had more time, I would have liked to ask both of you an additional question, because I feel that for many people, it's easier to relate to a disability that is visible. And I would have liked to have asked you how we do not forget people with invisible disabilities, for example, cognitive and sensory, that Jürgen spoke to, and to bring about improved accessibility and, of course, thus better health for those people. But given the time and where we are in the agenda, I hope we can move that on. We'll park that question for a future session that I really look forward to, but I'm going to move us through now to the next speaker, if I may, who is sat next to me, Dr. Dorrit Nitzan, my good friend and colleague, our Regional Emergencies Director. Dorrit, the floor is yours.
Hello, thank you so much, Rob, and I'm really honored to be here. Shalom, dear Chair, dear Odelia, distinguished ministers, ambassadors, delegates, dear colleagues and friends. So I am a woman, I'm tall, I'm just learning how to say, I have this white shirt with black polka dots, did I say it correctly? And very long earrings, I love earrings. But instead of telling you more details about myself, which I try to avoid, I will introduce also Satish Mishra, who is our regional advisor for people with disabilities. He's hiding, but I can tell you that he's wearing a suit with a tie, and he worked very hard on this event together with Ambassador Elon Shachar, Merav Elon Shachar from Geneva, and all of you. So really, I take this opportunity to thank you for doing that special event. I'm coming from the emergency side of things, and the emergencies, as we all agreed, actually reveal what are the diseases of our society. And everything is very clear during emergencies. The thing is that we tend to forget once the emergencies go away. And we think that everything will be okay. But I think that one of the issues is that I really appreciated Her Excellency Shirley Pinto, the parliament member, the Knesset member, that she said that emergencies might push the people with disabilities even further into the periphery. And this is so true. And that's what we all agree that we need to do. As we heard in our European program of work, we call it EPW. The EPW has one pillar that is focusing on protection against health emergencies. But in order to address the special needs of people with disabilities, we are working side by side, and you will meet her shortly, with Dr. Natasha Azopardo-Muscat and the other teams in-house, because here we need special care. This cannot be done by one team at all. in general. So it is important for us to make sure that risks and barriers faced by persons with disabilities in health emergencies will be shaped and address different factors, including gender, age, the type of disability, their settings. Do they live in rural, remote areas? You can imagine in the European region, we are covering 53 member states. In many places, the people themselves are at the margins, and the people with disabilities are further away in the periphery. Slums and other situations, we have to know the communities and make sure that in peaceful times, the community, as we heard before, identifies the people with disabilities, embrace them into the community, and have a plan for the emergencies to come. We have to also address the long-term care institutions and settings, among other that need to have special attention. So in the healthcare, we heard, we have to ensure that healthcare is always accessible. WHO has taken a number of actions to promote disability inclusion in the COVID-19 context. We have developed guidance for governments, healthcare providers, together and actually led by Satish, as I mentioned before, for persons with disabilities and their families, and to take disability considerations in the COVID-19 response. We have specific guidance, including for the vaccination program. We must know and get familiarized with each of the communities, and for that we work also very closely with the civil society organizations. And we have few of those, or some of those, that are very successful already, but I can just mention quickly, and we heard Greece, and so one is run by Greece, Together for Children, in collaboration with other CSOs. Lots has been done with those civil society organizations. We collaborate with organizations of persons with disabilities, and we heard before the European Disability Forum, and really try to address specific needs, to translate it in different languages and tools, and to ensure that the people with disabilities will not stay behind. A special attention that during the COVID we tend to forget is what happens in humanitarian crisis, in natural, earthquakes, floods, in man-made conflicts. People with disabilities need to have the hand, the arm, the heart, and the shoulder to actually include them in every action on the way. But let us share with you a short video, and then a few more words before I move on.
As COVID-19 continues to spread in our communities, we've been able to research the obstacles that excluded persons with disabilities from accessing the best information during the initial response. We discovered that too much information was inaccessible, especially to those who may have visual, hearing, and intellectual impairments. Even when it was accessible, it was sometimes too complex to understand. It could often be sensationalist and therefore sometimes fear-inducing for the viewer. To include every viewer and listener, sign language and subtitles must be used together in all cases. In short, what's needed is a clear and understandable flow of information in plain, easily understandable language that avoids confusion and alarm. We also discovered that persons with disabilities often felt excluded from information that was disseminated via digital platforms. Whether people are disabled or not, digital mediums might not be accessible for all. Inclusivity for everyone means that information must also be made available via posters, print, radio, and SMS messages. The expression, "every word which is written must be spoken," remains true for many persons with disabilities and means visual signage must be available and obvious in all public and transport spaces. We have a responsibility to make complete and up-to-date information accessible to everyone at each stage of the response. Finally, when it came to interpersonal contact, we discovered that transparent face masks, especially in medical settings, are vital in order that people can lip read, and that physical accessibility, especially to pharmacies and all the healthcare centers that remain open, is vital. What we've learned is that persons with disabilities in all environments and from all walks of life must be included in each stage of the planning for the COVID-19 response, especially when it comes to accessing information. To guarantee inclusion for everyone, it helps to remember the motto of the disability movement: nothing about us without us.
Yeah, thank you very much. And moving forward with the implementation of the resolution, it's very critical that we will continue to work together, that this will be one in many, the first of many of togetherness and moving into more partnerships with communities as needed. I thank you very much, and I am really honored to be with you.
Thank you, Dr. Nitzan, for highlighting how the COVID-19 pandemic has exacerbated pre-existing inequalities and recognizing that persons with disabilities are disproportionately impacted by COVID-19, both directly because of infection and indirectly because of restrictions. Thank you for reminding us that we must work on two levels: on recovery from the current pandemic and on building health systems that are more resilient against future health emergencies. To close the event and for final remarks, I would like to invite Dr. Natasha Azopardi Muscat, Director of the Division Country Health Policy and System at WHO Europe.
Thank you very much. I'm Natasha. It's really my pleasure to be here with you today. I'm 48 years old, and according to my children, I look my age. I'm wearing one of my favorite jackets today. It's a bright red jacket, which helps to lift my mood. It's been a long week for us, and today is Friday, so I'm already looking forward to the weekend. And of course, to match my jacket, if it's still on, I should have some of my favorite red lipstick too, which I save for special occasions. So that's me. And of course, the big earrings also. I think, like Dorit, I have a special affection for big earrings. What can I say? I think that this has been really an important event for WHO today. And so the first thing that I would like to start with, although it's written at as the last point on my notes, is to really thank the European Disability Forum, Israel, Germany, Norway, and the United Kingdom for having approached us to put this event together. I have learned so much in the preparation for this event that was capably handled by Satish, Thomas, and other colleagues. And it made me realize how little I actually know and how much more I should know. So this is an area that in my personal learning and development plan, I need to put something in, because clearly I have a long way to go. Of course, our European program of work, its hallmark is leaving no one behind. If we really mean that we don't want to leave anyone behind, we have to make sure that this includes, of course, people with disabilities. They must be definitely at the foremost of our attention when we plan policies. As health services, we should be amongst the closest of policymakers to people and persons with disabilities. So it is inexcusable if our health systems and our health services are not really working to ensure that everything that we provide is fit for purpose for persons with disability. We know that the barriers may be physical, and often those are easy to see, relatively easy to identify, maybe a bit harder to fix, but with the right will and the right support, you can do it. But beyond that, often it's the informational barriers, the attitudinal barriers. So what I can say is that the resolution, of course, has provided a springboard, but now at the European level, we need to see how we can work together to take this forward. This is an area where more than any other area, we can't do it alone as the Secretariat. We need to do it with you because you are the experts. And on this note, I thank you all very much for having put together this fantastic event. Thank you.
Thank you very much, Natasha. And I'm going to start just with the final words to say a huge thank you to my wonderful co-chair, Odelia Fitoussi. Odelia, you are a real champion, and I'm really, really looking forward to meeting you face to face at some point and for us to have a good hug and applaud each other for this great co-chairing. You've done the burden of the work, so thank you very much indeed for your co-chairing today.
Thank you very much.
Good job, Odelia. So, and thanks also to Natasha, to the colleagues here, all of you joining us today, of course, and others that will help develop the European Framework for Action to support the implementation of the disability resolution in this, the European region. I'd also like to extend our sincere gratitude to all of today's speakers. I won't list you. We're very grateful you could join us, all of the partners that join forces in organizing this event. And I will invite you to visit our YouTube channel to watch once again the Shalva Band, who I thought were absolutely incredible earlier today. They're up, we've loaded the video up, and so you can enjoy that. And I will close with just reiterating an important message that they send. Far too often, persons with disabilities face barriers and stigma and don't receive the health services they need. It is our responsibility to ensure that no one is left behind. Thank you, and we see you all again soon. Thank you.
Shabbat shalom.